Welcome to Buffalo Pregame, your source for live Buffalo football discussion, news, analysis, opinions, and more. Presented by ASM Publications and Bills Digest.
All right, let's start with Max Hairston. We know about the injury he sustained. I know it's kind of a unique injury, the LCL. You don't hear that all that often. I know that Andy Young of Spectrum News saw Hairston after today's practice on crutches. So what do we know about that LCL injury? What's the prognosis, the timeline for recovery, everything that Bills fans need to understand about Maxwell Hairston's injury?
So that was probably one of the best case scenarios, that he had a LCL sprain, which is pretty rare. According to the literature, it's like 2% of knee injuries. So, I mean, it's just not one that was on anybody's bingo card when you're looking at potential injuries, especially given the drill they're doing, and then knowing what they're looking at, the assessment from head trainer Alex Brasky, and then just everything else that went into that. So basically what happened is he likely somehow got his foot caught in the turf, and either he hyperextended the knee somehow, or the foot got caught in the turf and the leg kind of got planted, and then his body continued going another way, straight in the LCL, which is on the outside portion of the knee there. So this isn't a injury that always requires surgery. Sometimes it does with higher grade tears, but they can heal pretty reliably without surgery. The fact that Andy Young saw him in crutches and a brace, we don't know if he's non-weight bearing, which can happen in some cases there where they want to protect the area, or whether he just needed crutches to help support the knee. The brace is there to make sure it's locked out in place, so it's not stressing the knee as he's trying to bend it and move it around there. So this is all normal protocol, thankfully. We don't know how long it's going to be. I've seen some protocols saying it's up to 2 weeks, but we know how the NFL with its resources and the literature supports that they can come back sooner from this, but they also don't want to be too aggressive and try to rush him back either. Most of the literature is showing that it can be anywhere from they said 3 weeks, and Ian Rappaport's, Adam Schefter's, but we're probably going to see closer to a month, maybe 5 weeks. That might leave him being available health-wise for week one, but whether we actually see him play week one is a whole other thing because of those lost reps like we saw with Cole Bishop last year. So there's a small chance there could be other problems later on down the line in terms of other ligamentous issues such as ACL, PCL, MCL. There are certain cases like Traylon Burks had this issue a few years ago, and then later towards ACL. Robert Griffin III also had the same issue where he tore his LCL and later had an MCL tear. I will keep in mind, though, both those guys had previous ACL tears in their history, so that could have contributed to that. So what I'm trying to say is there's a chance that there could be some problems, but Hairston doesn't have the medical history that Griffin and Burks had. So they're going to take this slow. They're going to make sure they don't rush him back. They're going to make sure his confidence is up and that he can do everything. And when he does return, he's not going to have a brace, or he's not going to have any really restrictions. So it's like, we'll make sure he's going 100% until he's ready to go there. So it was a best case scenario, all things considered, but we're not going to see him rushing back, and maybe some football activities toward the end of August.
Yeah, so the 3-week timeline we saw from Ian Rappaport, obviously best case scenario, like you said, probably closer to a month for Maxwell Hairston. And there was a lot of speculation surrounding the injury. It was good to get the news released. We haven't spoken with Sean, or we haven't heard from Sean McDermott yet, speaking to the Bills media. So we will hear from him tomorrow, either before or I believe after the return of the blue and red. So be sure to stay tuned for that. And maybe we'll have an update on the timeline or something of that nature at that time. But why don't we talk about Cole Bishop next? We'll move right along down the line. What do you know about his injury? There isn't as much that we know about that injury as the Maxwell Hairston one. It was just described as a quad injury before today's practice. What do we know specifically about Cole Bishop's quad that left him without practice?
Like you said, we don't know a whole lot, but considering when you say a quad, either you're thinking a contusion, or then you're thinking a strain to the muscle. Considering he kind of just left quietly, and then they got him checked out, you got to think one or the other, especially with the recent introduction of the pads, them hitting and whatnot. So it's going to come down to just what timeline they give. You hope it's contusion and they're being cautious, but there certainly could be a strain. He does have some soft tissue history with a hamstring in college. And then obviously we saw last year with the shoulder or whatnot. So we need a little bit more information on this, how long he's going to be out. But I mean, with everything that he went through last year, they're not going to be rushing to try to get him back out there. And the extra days off like they had yesterday is certainly going to help them to make sure that he's going to be ready to go for when the time comes.
And how about Josh Palmer? I don't think we really know anything about his injury. I posted some videos. Some others did as well. Did you take anything away from those videos? Have you heard anything in your passings by on X? What do we know about Joshua Palmer's injury, if anything? He left individual drills, was talking with athletic trainers, and then later just stood off to the side to watch team drills. So no participation in team drills for Joshua Palmer on Thursday. What do we know?
Not much. I saw the video. I think you posted that he was off to the side with the athletic training staff, and that he was doing like high knees and kind of just seeing how his body responding. So that makes me think that some type of lower body injury, whether it's like a hip flexor or whether it's some type of hamstring or even a knee, where just trying to make sure that how the body responds to those activities there. But they're smart to hold him out. He also has a history of different injuries that have really kind of held him back. When he was with the Chargers, albeit he was also deeper on the depth chart, there being Keenan Allen, Ladd McConkey, and those guys there. So they're smart to be holding these guys out, especially with the heat being the way it has been recently, though today was a little bit better. So we'll get more information on Friday before they practice at the stadium. But, you know, they're just being cautious, especially with the rash of injuries that we're seeing. There's no sense in getting guys out there. And then you look at for the UDFAs, the guys deeper on the depth chart, you might as well give them every rep possible, because you might find a diamond in the rough through all that there too.
Welcome to Buffalo Pregame, your source for live Buffalo football discussion, news, analysis, opinions, and more. Presented by ASM Publications and Bills Digest.